Welcome to Vet Image Lab. This is part 4 of our echocardiographic series on feline HCM. In this final lecture, we'll cover 1. Important differential diagnoses, 2. Key prognostic indicators, 3. And a practical checklist for diagnosing HCM with confidence. If you haven't watched the first 3 parts yet, I highly recommend doing so before continuing. In previous lectures, we discussed how to identify left ventricular hypertrophy, recognize hypertrophy patterns, assess dynamic LVOT obstruction, and evaluate left atrial enlargement, thromboembolism, and congestive heart failure. They will greatly help your understanding of today's content. Now, let's start today's lecture. Before making a definitive diagnosis of hypertrophic cardiomyopathy, it is essential to rule out other potential causes of left ventricular hypertrophy. First, let's consider pseudohypertrophy, which is not a true pathologic condition. This can occur due to dehydration, where the reduced preload makes the ventricular walls appear thicker than they actually are. Next, secondary LV hypertrophy must be considered, as it can mimic primary HCM, but arises from systemic disease. The most important condition to consider is hyperthyroidism, especially in cats older than 6 years. Elevated thyroxine levels can lead to increased cardiac workload and concentric hypertrophy. So, always measure serum total T4. If the result is equivocal, follow up with free T4 or TSH testing. Another common cause is systemic hypertension. Hypertensive cats typically develop only mild to moderate left ventricular hypertrophy, usually between 5.5 and 6.5 millimeters. So it is critical to measure the blood pressure before performing echocardiography. Also consider secondary causes of hypertension, such as chronic kidney disease. In that case, check serum creatinine, SDMA, and perform a full urinalysis. By ruling out these conditions, we can improve the accuracy of HCM diagnosis and ensure that treatment decisions are appropriate. Once we confirm the diagnosis of hypertrophic cardiomyopathy, the next important step is to assess the prognosis. Several echocardiographic and clinical factors are associated with a significantly worse outcome. First, left atrial enlargement is one of the strongest prognostic indicators. The severity of LA enlargement is closely linked with the development of congestive heart failure and aortic thromboembolism. Once either CHF or ATE occurs, the prognosis is substantially worse. In addition, severe LV hypertrophy, especially when wall thickness exceeds 9 millimeters, is also associated with poor outcomes. Arrhythmias such as ventricular premature complexes or atrial fibrillation. Elevated cardiac biomarkers such as NT-proBNP or troponin I and reduced LA function are also negative prognostic factors. Interestingly, dynamic LVOT obstruction is not considered a poor prognostic factor in cats, unlike in human patients. By identifying these risk factors, we can better stratify patients, tailor treatment strategies, and advise owners appropriately. Let's talk about how echocardiographic findings guide our treatment decisions. In asymptomatic cats, no medications are needed in most cases. When there is a significant LVOT obstruction, beta blockers, such as atenolol, to reduce heart rate, helps decrease the pressure gradient. Heart rate control is key. If the patient presents with congestive heart failure, such as pulmonary edema or pleural effusion, we manage these cases with diuretics like furosemide, oxygen therapy, and strict rest. Finally, in cats with high ATE risk, showing severe LA enlargement, spontaneous echo contrast, or a history of ATE, clopidogrel is the first-line agent. Now let's summarize the key echocardiographic checklist for evaluating feline hypertrophic cardiomyopathy. First, evaluate left ventricular hypertrophy. Use both 2D and M mode to measure wall thickness. A thickness greater than 6 millimeters confirms left ventricular hypertrophy. If it exceeds 9 millimeters, this is associated with poor prognosis. Be aware of pseudo-thickening and secondary causes of hypertrophy. Also assess the hypertrophy pattern, whether it's symmetric, asymmetric, or focal. Common locations include the septal base, papillary muscle, or mid-left ventricle region. Second, Check for LVOT obstruction. Look for systolic anterior motion, the mitral valve, on M mode, and color Doppler. Also check the papillary muscles and midventricular obstruction. Third, assess left atrial size. A normal LA to AO ratio is less than 1.5, and values above 1.6 indicate stage B2. Fourth, evaluate for thrombus formation. Severe LA enlargement, spontaneous echo contrast in the left auricle, or visible intracardiac thrombi suggest high risk of arterial thromboembolism. Finally, check for signs of congestive heart failure. Use thoracic radiography and monitor respiratory rate. A rate over 30 per minute may indicate CHF. By following this checklist, you can ensure a structured, thorough, and clinically relevant echocardiographic assessment in feline HCM. That wraps up our lecture on the echocardiographic evaluation of feline HCM. I hope this checklist helps you approach these cases with more confidence and clarity. If you found this video helpful, please like, subscribe, and share it with your fellow veterinarians. See you in the next lecture. Thanks for watching Vet Image Lab.